A dental extraction is a dental procedure where we remove the tooth from the area. The reason why you should get a dental extraction can range from toothaches to dental abscess to teeth that can no longer be restored or saved. There's different types of dental extractions, and it can range from a simple extraction, which is when we do the procedure and it's relatively straightforward to take the tooth out. There are more complicated dental extractions that may require sectioning the teeth into different parts, or uncovering the gum tissues, or removing some bone, which the dentist will go through prior to starting the procedure. Usually an extraction is a typically less painful process, or pain-free process. When we do the extraction, we numb the area up as best as possible so that you don't feel any sharp pain, is what I tell patients. A normal feeling that you would get with dental extractions is the feeling of pressure in the area. The extraction procedure can range from a couple of minutes to more than that. It really depends on the difficulty of the tooth coming out and the number of teeth that needed to be taken out. The recovery time for an extraction ranges from patient to patient. Multiple factors contribute to that. If the extraction was relatively simple and the patient's healthy and they follow the post-operative instructions, usually extraction recovery time can take anywhere from a few days to a week or two. Some more complex extractions may take longer, especially if there's issues with healing or if there's something with the patient's medical history that may negatively affect the extraction site, as well as how the extraction site was taken care of. There are alternatives to an extraction. Usually if the tooth is a tooth that can be saved or restored, or a root canal procedure can be done, or the tooth can have a filling or a crown placed on it, usually those are alternatives to taking the tooth out. If, however, the tooth cannot be saved or restored, then usually the only other option is to have the tooth taken out, which your dentist will go over with you thoroughly. The pros and cons of an extraction range primarily. If the tooth is extracted, the main downside to having a tooth extraction is that usually you'll end up with a space in the area which may negatively affect the other teeth. The benefit to an extraction is usually once the tooth is out, there really isn't anything that can go wrong in that specific area if the source of the dental pain is coming from that tooth.